So it raises, though, the question that they have to be, however, concerned about misinformation because it is a real thing. And we see misinformation all the time, and it's coming from sources that are not designated to be accurate and so on. What do they do? And I'm asking you as to how just imagine this was Ebola and you are having misinformation going out there. It's nothing to worry about, nobody dies, that kind of thing. How does public health react when there is clear misinformation?
I think public health has to, again, address misinformation with complete transparency. That means they've got to be honest about everything. Everything. I mean, CDC is now, if you start reading between the lines, CDC is now coming out and saying everything we're saying, Dr. Phillip. They're just saying it in a way that people can't understand. For example, a peer-reviewed paper that comes out of CDC that says the first batch of RT-PCR tests were horrible and they didn't do the job that they were designed to do. That's a peer-reviewed paper that uses so much scientific jargon that a common person would not be able to say that it's CDC saying we messed up in testing. The same goes with all of the side effects that are happening as a result of this injection. If you go to VAERS data, I mean, the public health has to communicate with complete transparency. That means they say the good and the bad. And the neat part is, for almost 24 years, public health, in my opinion, had always tried to do that. Look, our job is to give you, this is what's good about it, this is what's bad about it, and we're going to empower you to make the decision that's best for yourself and your families. They also need to have empathy. My gosh, if you're denying that this injection causes or doesn't cause damages, I really don't even know what to say anymore. You can go to openvaersdata.com and look for yourself. There, even CDC and all the public health agencies are now acknowledging that there are damages that do occur as a result of this injection. I don't care if it's a small portion or a large. I don't care. You need to have empathy for those who have been injured. And primarily injured under strict coercion, so to speak. So empathy is critical in public health. And then last but not least, Dr. Phillip, most important, we need accountability. We need to hold people accountable. And until I see the FDA and the CDC, I mean, Dr. Fauci rides off into the sunset. I want accountability. I want terminations. I want firings. I want court cases. I want accountability for people that misled and misinformed and called me a misinformer. I want to, why? Because look, I'm not going to argue whether or not you should get the vaccine. That's not my decision. That's your decision. All I want you to do is be an informed consumer. All I want to do is have a chance to tell you both sides so that when you make your decision because it's the best decision you could possibly make for yourself and your family. My mom and dad, both of them are vaccinated twice. They got all of the information and they still decided to get vaccinated. And that is their right. That is their choice. And I support that as a public health professional because it's not about me. It's about who I'm serving. They have chosen not to get the boosters based on all the information that they're seeing, the good and the bad. It is my job to inform and empower people, not give them only one side of the story, but all sides. And that's what public health needs to do. They need to practice, my first talk with you, Philip, transparency, full transparency, empathy with those who are suffering and hurting on both sides, both the vaccinated and the unvaccinated. And last but not least, we really need to hold people accountable. We need to hold people accountable for what they've done. And they have done a lot of things, in my opinion, that have led to unnecessary death and suffering of millions globally.
You ask a hard question, and I know that I've reflected on this, and I do agree with you that there have been many mistakes. I do think that there does need to be a degree of accountability. My question is that I don't think we can afford to damage public health generally, because we need public health. The world is not just about COVID. There is so much more that public health does that is critical to safety, health, and population development. How do we get that balance?
It's such a good, well, first and foremost, public health should never, ever be owned by politics. Anytime, and I noticed this in HIV, back in HIV, HIV became a political matter, and again, millions suffered as a result of that. COVID, it became a political matter. Millions suffered as a result of that. Politics don't belong in public health. So let's get rid of the politics. Let's say we're dreaming right now. Dr. Philip, you've given me a couple of wishes. Number one, politics can never be involved in public health. You get them out. Okay. So we're talking about the people. The second thing is that healthcare doctrines cannot be involved in public health. There have been so many physicians, so many who have lost their careers and their livelihoods. Same goes with nurses. When I have worked on the front lines of emerging infectious pathogens, I've seen physicians throw the kitchen sink. They may not have what they need for a solution, but by God, they are not going to let their patients die without a fight. The way that this happened, where drugs that existed that were safe and effective, for me as a public health professional, when I visited areas where malaria was endemic, I took ivermectin and hydrochloroquine multiple times in my career because I was a malaria prophylaxis. To watch doctors be told that they can't treat their patients the way they want to be banned from drugs and repurposing drugs to find solutions for patients that were dying. I just think that's dead wrong. So get rid of healthcare doctrines. And then the last compromise is big pharma. It is clearly evident that FDA and CDC and multiple organizations are bought and paid for and compromised by big pharma. And that, again, if you want true public health, you're not going to look. Public health wasn't always about giving you a pill. You know, if you had high cholesterol, it wasn't about sending you to pharma to solve the problem. It was, we were going to work with you to modify diet and lifestyle changes to get a good result in you to minimize your cholesterol. We didn't just send you to get a pill in your hand. And so public health has been compromised, in my opinion, Dr. Philip, by healthcare doctrines, politics, and big pharma. And until we get rid of that compromise, until that is gone and public health can serve the people for the people,